Hello, I'm Dr. Carlo with AnxietyBoss.com. I'm going to answer a question today about how do you take Zoloft for social anxiety disorder. I had a question from a viewer who repeatedly emailed me about a question that really he should have for his doctor, but I decided to make a video about it because it is a common question about medication questions about anxiety disorders and how do you take your meds. So this specific viewer is located in Afghanistan, and he stated that his psychiatrist had diagnosed him with social anxiety disorder and prescribed him Zoloft, and then stated that he has not had any contact with a psychiatrist since then, and has had many questions, and has tried repeatedly to contact a psychiatrist, but a psychiatrist is not answering him. So I'm not sure exactly why there's no response from the psychiatrist, but let me answer this question. So his question was, how, having social anxiety disorder, how should he start the Zoloft and for how long should he take it? So Zoloft is also known as sertraline. It's classified as a selective serotonin reuptake inhibitor, also known as an SSRI. Zoloft is called an antidepressant because it's prescribed for depression, and it's also prescribed for anxiety disorders such as social anxiety disorder. Now, social anxiety disorder is also known as social phobia. So social anxiety disorder is where you have an extreme fear of social scrutiny. You have a fear of embarrassment in front of crowds of people, or you might have fears of performing in front of people because you think you might make a fool of yourself or you might embarrass yourself. So one of the options for treatment for social anxiety disorder is looking at medication treatment such as an SSRI. Zoloft is a good choice because of all the SSRIs, it actually is generally well tolerated, and it seems to be effective for anxiety disorders. Now, for Zoloft, when you start Zoloft for an anxiety disorder such as social anxiety disorder, you want to start it when I'm giving this advice, I'm giving this advice as general advice. I'm not giving this advice to any particular person because in order for a doctor to give medical advice, they need to evaluate the patient. And of course, I haven't evaluated you, so I'm just giving general advice. So again, the disclaimer here is that you have to follow up with your prescribing doctor for specific questions for your specific case. But I'm talking generally for social anxiety disorder. Zoloft is a good choice generally for an anxiety disorder such as social phobia. So when you start Zoloft, and I'm talking in a general matter, you generally start it off at between 12.5 to 25 milligrams daily, and you want to do this for about 1 to 2 weeks. And after a couple of weeks, when you visit with your doctor next, your doctor might then increase the dose by 25 to 50 milligrams. So the therapeutic dose of the Zoloft is anywhere between 50 milligrams to 200 milligrams daily. So your doctor with each visit, so you might see your doctor every 2 weeks when first starting the Zoloft. Your doctor might increase it by 25 to 50 milligrams and increase it until you have a clinical effect to the anxiety. Now, not only do you have to have the right dosage for it to work, so between 50 to 200 milligrams of Zoloft for it to work for social anxiety, you also need to take it for enough time for it to work. So it could take up to 6 to 8 weeks for it to work. So if you have a therapeutic dose between 50 to 200 milligrams daily of Zoloft, and you've taken it for up to 8 weeks, that should be enough time, and that should be enough dosing of the medication for it to work. And if by that time you have not had a good effect to the Zoloft, then your doctor at that time might help you to choose different options to treat your social anxiety. So I hope this answers your question. Thank you for listening. I'm Dr. Carlo Carandang.